I reviewed my physician orders, and his order is to suction a trach. And after I review my physician orders, I will wash my hands before I enter the patient's room. And then after I enter the patient's room, I'm going to identify myself, and then I'm going to use 2 identifiers on them using their armband. And after I'm going to explain the procedure and tell them what I'm going to be doing. And after I do that, I can go ahead and hyperoxygenate them at least 30 seconds or more. And then I can go ahead and set the wall suction on no greater than 125. And after that's set, I can go ahead and come over here and I'll do hand hygiene as needed. And I will go ahead and open this. And before I put my sterile gloves on, I'm gonna go ahead and set my sterile cup up, make sure I don't touch the inside of it. And I'm gonna check, make sure this is not out of date and it's intact and not contaminated, and it is, it's good. And I'm going to keep it at the palm of my hands, and I'm gonna lip it and pour it in here. And after I do that, I'm gonna move it over here so it can be closer to when it's time to suction. And I'm gonna go ahead and open this. And put my sterile gloves on. And take a step back. And after I do that, I'm gonna go ahead and this is gonna be my dirty hand, my left hand, and the right hand is gonna be my clean hand. So this is my clean hand. I'm gonna go ahead and take this out, and I'm gonna keep my and I'm gonna hook this part up. This is my sterile hand, so I can touch this part, my clean hand. And I would go ahead and hook it up. Well, it don't fit, but in real life it would. And after I get it connected, I'm gonna take this part, stick it in there, and I'm gonna do it intermittently, testing my system. And after I do that, I can go ahead and take this off. And I'm gonna insert until to the point where the patient coughs. And I'm not going all the way until I feel resistance. And I'm gonna suction between 10 to 15 seconds. And after 10 to 15 seconds has passed, I'm gonna withdraw slowly, intermittently. And then I will put it back in the sterile water or normal saline or whatever, and I would test the system. But since I'm doing it one time, after I suction them for 10 to 15 seconds, no longer, I would dispose of this if it's a disposable one, and I will put this back on the patient and hyperoxygenate at least 30 seconds after I suction between each pass. And after I do that, I will put them back in a comfortable position and see how they tolerated it, make sure there's no distress, and I would dispose of everything, and I will go document.